There we go. Thank you.
Did that do it?
That did it. All right, we can go ahead to the next slide, please. As I mentioned, the Department of Education, all school districts are required to submit a phased school reopening health and safety plan. The plan has to incorporate enough flexibility to adapt to changing conditions. The plans must be approved by the school board prior to August the 3rd. Each plan must be posted on the district's publicly available website prior to reopening school, and each plan has to be monitored throughout the year and updated as needed, which of course we will be doing. Next slide, please. In order to develop the plan, we first established a pandemic planning task force. As superintendent, I am serving as the pandemic coordinator, but I'm very pleased to have this task force supporting me and all of the efforts of the district in regards to how we're responding as a school to the pandemic. As you can see, we have a broad cross-section of our school stakeholders, building administrators, teachers, school board members, food services, and we were privileged to have Dr. Raymond Hubbard from Reading Pediatrics be a consultant as well on the plan. Next slide, please. All right, on this slide, this is our subcommittee. So as you can see, between the members of the task force and the subcommittee structure, we were able to engage even more stakeholders, both internal to the school district as employees and external as parents and community members. Each of the 6 areas represents a portion of the plan. You can see each was assigned a lead, and then members were initially selected from people from the task force, and then people from the task force were asked to suggest other people in the community, parents, etc., who may be of value in terms of bringing their thoughts to this process. So as you can see, a large number of people gave their input. And again, I want to extend my sincere thanks to everyone who participated in the development of the plan. Next slide, please. One of the things that we recognize is critically important is communication. And so we are looking to push out information to our community about what's happening and what we're doing, but also to solicit communication back from our community and our staff in terms of their thinking, their thoughts, their concerns, their questions, so that as we continue to develop our plans, we're doing that in response to feedback from all of those stakeholders. Recently, I put out an update video talking about our pandemic plans, and that video to date has over 4,000 views. We sent out a staff survey that has garnered 355 responses, and a parent survey that as of this morning had 1,823 parent responses. You can see that from that survey, 70.9% of parents indicated that if schools were open for in-person instruction, it was their intention to send their children to school, and 16.9% would prefer to send students to an Exeter virtual school if one was available, which it will be. The remaining parents were either uncertain or had private school or other types of plans. For the vast majority were uncertain at the time of the survey. Next slide, please. There were a lot of common themes. There were over 900 individual open-ended responses, and we tried to group those open-ended responses into broad categories. There were many people who are urging us to reopen fully. There were many people who are urging us to consider a virtual or hybrid option. There were a number of people who expressed concerns over safety and had very specific questions regarding safety protocols. There were a number of people who had wanted to express that they were anxious or their children were anxious about the potential of either virtual school or in-person school. Both were anxiety inducing to different people. And then there was a certain number that were just thanks, appreciating that we were soliciting feedback, appreciating the hard work that went into it, appreciating our teachers, our support staff, our administrators, who all work so hard to bring school to us in pandemic and non-pandemic times. Next slide, please. The biggest, I think, back and forth in all of the comments were parents who felt strongly that masks should be worn by everyone at all times, and parents who felt strongly that masks should never be worn or worn, infrequently. And that issue was settled for us prior to us coming forth with our plan by the Pennsylvania Department of Health that made it clear that everyone would need to wear a mask unless they were able to sustain more than 6 feet of distance from another person, or they had a specific ADA exemption. So although we did receive a lot of comments on that, it's no longer something that the school district can take any action on other than following the Department of Health directives. Next slide, please. Some of the other comments that were just miscellaneous, people talked about, appreciating the district's dedication. Some people said, that they hoped it would be online school. It's been a difficult year. And then a lot of people said things like, above all, I just want my kids to be safe, whatever that means. And certainly as a parent myself, I certainly understand that and feel that for my own children. Next slide, please. Thank you. As part of the planning process, we had 4 types of reopening that we were able to select from. I've color coded them. Option 1 was the option that was most in line with a green phase, which is what Berks County is in right now, and that's a total reopen with a virtual option for families or students who prefer distance learning because of safety or health concerns. And we'll be talking more about why we selected that one in just a moment. Option 2 was a scaffolded reopening. That's more of a yellow phase option for most people. And that's where some students are engaged in in-person learning while others are distance learning. So some grade levels are in person while other grade levels are remote. Option 3 was a blended reopening. Again, more of a yellow phase opportunity. That balances in-person learning and remote learning for all students. So for instance, some students would come on Mondays and Wednesdays, and other students would come on Tuesdays and Thursdays. And then the final option was red phase option primarily, which is total remote learning. And if a school selected that, a big portion of their plan had to be explaining how they were going to open for in-person instruction and when. Next slide, please. So I'm going to go through the ones that we didn't select first and talk a little bit about why we didn't select those. So as I mentioned, option 4, total remote learning, was designed for districts who are in the red phase, and it focuses ultimately on reopening in the green or yellow phase. So that's not applicable to us at this point in time, as Berks County is currently still in the green phase. Next slide, please. Option 3 was a blended reopening. Some of our neighboring school districts entertained this, and I got a lot of questions about it as superintendent. Some people are referring to it as a hybrid opportunity. Again, it would be where some students came on Monday and Wednesday, other students came on Tuesday and Thursday, and nobody came on Friday, and it was a virtual experience. This wasn't selected either. So why did we not choose this one? Well, first of all, the safety benefits for this type of reopening rely largely on the assumption that when students aren't in school, they are isolating on those off days. While students are in school, we are able to control a lot of the environment in terms of what the seating looks like, whether or not students are wearing masks, what spacing looks like, etc. When students are home by themselves, we have no control over what they do. And so, in conversations with, fellow superintendents around the county, the idea that, on those off days, students could be gathering in homes, not wearing masks, not social distancing, without parent supervision because parents were at work, and potentially actually increasing the viral load in our community as a result. Another reason, and we heard this from a number of parents in the survey, was that childcare will be extremely difficult, if not impossible, if parents had to seek out childcare on only 2 days a week or 3 days a week versus a more typical childcare schedule that would either be a full-time childcare or an after or before care scenario. And then finally, if our own staff was in that position where they needed childcare, we may find ourselves with a very limited staff pool, and we would have to consolidate classrooms, which would ultimately eliminate the potential benefit of reduced student numbers in classrooms if we were functionally short-staffed. So those are the primary reasons that we determined that this wouldn't be a beneficial option for Exeter. Next slide, please. Option 2 is a scaffolded reopening. This, I believe, is what was proposed in Boyertown. This option would have allowed some students to come in certain grade levels and other students not to come. This option would have limited benefit in Exeter. Presumably, in this model, you would bring in young students while older students would stay home. Again, we would have those viral load concerns in the community. What were students doing outside of school, and then potentially giving to their siblings in terms of infection that would ultimately come to school as younger siblings. And unless we then move the younger students into the vacated buildings that were designated for older students and designed for older students, there wouldn't be a benefit in terms of distancing. And our buildings are, you know, from toilets to desks and chairs, not designed at the high school or junior high level to support elementary students. So that didn't seem to be an option that had a particular benefit to Exeter. Next slide, please. So the final option, and the option that the majority of the districts in Berks County have selected, as well as Exeter, is option 1, which is a total reopen with a virtual option. This option provides maximum flexibility to our families. Families who wish to have their students attend in person may do so 5 days a week, and those who feel unsafe or unable to return will have a full Exeter Township School District virtual option. Later on this evening, we will be asking the board to approve a memorandum of understanding with our Teachers Association, ETEA. I'm pleased to say that we've had wonderful discussions with them, and we'll be partnering with them so that our virtual option will be primarily composed of Exeter teachers delivering Exeter curriculum, making it far superior to what a number of our neighboring districts are able to provide, as well as certainly far superior to a cyber charter option. Next slide, please. In terms of the contents of the plan itself, I'm not going to be going through every item of the plan. The plan is available now as an attachment to the board agenda this evening. It will also, as I mentioned, be posted on our website following approval of the plan. But just to give you an overview, as I mentioned previously, the plan has 6 primary areas. The first one involves cleaning and disinfecting buildings, ensuring buildings, supplies, buses are cleaned and disinfected. So anything that was shared between students in terms of any classroom items disinfected. And Ms. Guidish led up that committee as she heads up our facility staff who typically do that work, and has already been acquiring large amounts of cleaner, disinfectant, those sorts of things that will be required to keep our schools clean and disinfected. The next group was social distancing. How do we organize spaces to promote social distance? How do we create protocols and procedures around distancing practices? The third portion of the plan is monitoring. How do we develop protocols for monitoring student and staff wellness? And how do we create procedures and protocols around quarantine and safe return? The next portion of the plan is other considerations. This deals specifically with policies, procedures, and protocols that will be needed to implement the plan. This talks about students who may be at increased, or staff who may be at increased risk due to physical impairments or disabilities, high-risk health categories, those sorts of things that may need special plans outside of the broad plan, as well as ensuring staff are deployed effectively and considering mental health and social emotional well-being, both for staff and students in the community during this time. Communication, how do we have timely and effective communication with family and staff? What does ongoing communication look like with the state and local authorities? And then finally, professional development. How do we ensure that all stakeholders are prepared with the knowledge and the skills necessary to implement the plan? Next slide, please. So what does the future hold? I have no idea. You know, this is something that, you know, on March 12th, if you had told me that I would be sitting here on July 21st talking about pandemic planning still, I wouldn't have believed you. And so I think we've all learned that this has been unpredictable. Changes have come quickly, information has come quickly. And so, you know, as superintendents, as school leaders, we've all learned that we have to be flexible, but planful. So as we stand today, you know, we are technically in the green phase, but we are bordering on yellow in terms of the data and statistics that are in Berks County. So while we're in the green phase, it's our intention to move forward with the plan as presented if approved this evening. If conditions deteriorate, this evening the board will be asked to approve an emergency resolution that would allow the superintendent to close schools if conditions in our community deteriorate and it no longer would seem to be safe within reason to have students report for in-person instruction. And that would be if the state hadn't made that decision on their own, that we could do it unilaterally. And then finally, if the state determines that schools are ordered to shut down, then we'll plan accordingly. I think that this is a very real possibility that schools will be shut down by the Department of Health or by the governor. For those of you who listened to the governor's address last Thursday, he made it clear that cases were pouring into western Pennsylvania, into Pittsburgh, over the Ohio border, and pouring into southeastern Pennsylvania up through the I-95 corridor, through Florida, the Carolinas, Georgia. And he expressed that, that bars were going to be closed. Could you go back to that slide, please? Thank you. That bars were going to be closed, that restaurants were going to be at 25% capacity, and that masks were required, as well as additional guidance around keeping the public safe and this disease at bay. And he specifically called out that if over the course of the next several weeks Pennsylvania's numbers did not improve, that the consequence would be closing of schools. So we are preparing for that possibility as well. Both that schools will never open in August in the first place due to a government ordered shutdown, or that at some later point schools will be closed if there's a resurgence, for instance, during the flu season. So we'll be prepared for that if it would happen. All right, last slide, please. I think that the most important thing that we can do right now is to come together as a community. One of the things in the course of my entry plan, as Dr. Hemberger mentioned, I spent many weeks speaking to stakeholders, former administrators, parents, business owners, teachers, support staff members, board members. And to the person, when I asked, what is the greatest strength of Exeter, people said, it's our community. Our community is amazing. Of course, they said our teachers are amazing, but really what really was outstanding to me was how many people referenced the strength of the Exeter community. And, as superintendent, I really hope that we see this as an opportunity to stay Exeter strong, to come together, to not let, political divisiveness or other topics divide us. This little graphic is, rowing in different directions that ultimately has no beneficial effect. And so from what I have seen so far, I believe that Exeter is exactly the kind of community that can do that can stay strong, that can stay unified, kind of community that believes in our schools, that supports our schools, that care about our children, and want truly the best for them. And I think the best way that we can get to that point is to stay together as a community. We're not going to agree on every point, certainly. That's healthy, that's encouraged. We need dialogue, but respectful dialogue, and dialogue that's intended to move us forward, not divide us and have us not be able to make the progress we need to educate our students safely. So that concludes my presentation